Okay, so with our contraindications, you can use heat on acute injuries depending on the severity of the acute injury. If somebody has just had surgery and it's been 12 hours since their 12 hours post-op, I would not use heat on that. I would be following the doctor's prescriptions, and most likely they're going to prescribe ice. So acute injuries, meaning, like it's still inflamed from spraining their joint, they overstretched their shoulder, you have things like compartment syndrome and stuff like that. So you can use heat, but you can't use any pressure because that's a contraindication for massage, because you don't want to be tearing apart an already ripped muscle. It hasn't healed yet. When you do that, it's strongly suggested that you flush it with ice so that you're doing more of a cold and hot therapy as opposed to a massage. Pregnancy. Some pregnancies, they have a higher volume of blood. So their blood pressure might be a little bit higher during pregnancy. So I would go to a treatment modification for pregnancy. They also have increased range of motion because of all those good hormones that are flowing through there. So they might not need the heat to increase the range of motion. Like acute asthma. Anything that's not controlled is a contraindication for massage. Therefore, it's a contraindication for using heat. Any type, if you can regulate your asthma, regulate your diabetes, regulate all of your acute inflammatory autoimmune diseases, you can use hot stones. However, I would go to the treatment modification first. Be safe with it. Use a warm stone first. Treatment modifications are after, so definitely memorize that next chapter. If you have unregulated high blood pressure, you can't use stones because we're bringing more blood in, creating an already high blood pressure. It's just a disaster. Don't do that. So if it's regulated and the client is fine with massage, you can start to introduce these through your treatment modifications. Cancer. If you have a patient with cancer, I would suggest you take extra courses like oncology courses and ask how heat would impact them. Every patient's going to be a little bit different depending on where they are in their cancer treatments, if they just had the surgery, if they're going into their chemo and their radiation. So depending on where they are at in their cycle, it's going to be a little bit different. So oncology massage is going to teach you more about that. So if you don't know anything about that, then I would suggest you do not use heat on patients with cancer. Varicose veins, we stay away from the varicose veins, but you stay away from varicose veins when you massage. So it's very similar. If you wouldn't massage it, I would not use heat. Burn scars, if they aren't fully healed, I wouldn't use it. Burn scars also have a thinner skin, so that skin is going to be more sensitive. So I would go to a very, very lukewarm room temperature stone if you still want to use it for a mechanical advantage. But just be aware that the burn scars are going to be more sensitive. If you have a patient with kidney dysfunction, that's also a contraindication for massage. So everything is very light. I wouldn't use any added heat to overwhelm their kidneys when the increased blood flow happens. Rheumatoid arthritis, we don't want to add heat to an already swollen joint when it is more of an autoimmune disease or something like rheumatoid arthritis.